Hi, I am Anna Swann, a PhD candidate in Instructional Technology and Design, and this is my proposal, Barriers to Patient Portal Use and Access to Patient Education Materials among Mississippi Adult Residents. So a little background on patient education. Um, Patient education is actually the utilization of health information and instruction to influence patient behavior and to produce a change in their knowledge, attitude, and skills necessary for them to maintain or improve their health. And it plays a major role in the improvement of health outcomes in those with chronic diseases, as well as preventing illness in otherwise healthy people. Educated patients can make informed decisions about their health care and are going to be more engaged in their health care. And one method used to engage patients in their health care is health information technology. And what that is digital technology designed for patient care management and communication. Thanks to the HITECH Act, or the Health Information Technology for Economic and Clinical Health Act, there has been this surge in the use of HIT, such as electronic health records. An electronic health record is the digital record of the patient's health care. It's what physicians have access to. And patient portals, that's part of electronic health records, and that's how the patient actually accesses their personal health information. Patient portals allow the patients to view their medical records, request appointments and medications, refills, communicate with the providers. Patient portals can also be used to provide education materials tailored to the patient's healthcare needs. Patient education can improve health outcomes through promoting a change in patient behavior and improving their health literacy, therefore helping to eliminate the risk factors for developing a chronic disease. So perspectives of portal use. Patients and providers alike consider the efficiency of portals, access to personal health records, and the messaging features within those patient portals to be a very positive feature. And they all believe that patient portals can help improve health outcomes and are essential to medical care. But there are also barriers to portal use. Across all races, ethnicities, socioeconomic standing, the majority of people do consider access to personal health information essential to their medical care and for improving health outcomes. But there are many barriers. Minorities, elderly, and patients with limited health literacy face the most barriers, whether it's computer anxiety, computer literacy, no internet access, even lack of awareness of the patient portal. But patients with limited health literacy are less likely than patients with a high level of health literacy to use a portal. And what health literacy is, that's the ability of individuals to utilize health information and health services to make informed and appropriate health decisions. Electronic health records and meaningful use have come into play. And what meaningful use is, it's part of that HITECH Act. It's an incentive program for facilities to implement electronic health records, and has led to patient engagement with use of patient portals. Patient engagement began with encouraging them to keep paper records, and now due to this, it's progressed to electronic health records. But there are 5 health outcomes designed to improve public health within this meaningful use. So meaningful use aims to improve the quality of health care and reduce health disparities. It aims to improve coordination of care, improve population and public health, and ensure the privacy and security of personal health information. And specific to this study, engage patients and their family in their health care. And one way to do that is to provide those education materials tailored to the patient within the portal. So EHRs and patient portals help to make meaningful use outcomes achievable. by allowing members of the healthcare team and the patient to have access to past and present health information, therefore reducing medical errors, providing a better quality of care, and the information shared with the providers is more reliable. So why is all this important to Mississippi? In the United States, 7 out of 10 deaths are related to chronic disease. In Mississippi, 7 of the leading causes of death are due to chronic disease. Mississippi is higher than the national average. If patients access patient education materials within their portals, then they have the information to modify their risky health behaviors and hopefully improve their health outcomes and prevent these chronic diseases from developing in the first place, or at least prevent complications from those diseases. But there are still numerous barriers to portal use. Literacy and education levels do not equate to health literacy levels. So not only is it important to look at technology barriers and those other barriers, but it's also important to look at health literacy levels as well. If we can understand why patients are not using patient portals, why they're not using patient education materials, we can better know how to promote their use and help make Mississippi a healthier state. So we know portal use improves health outcomes. We know portals are perceived useful by physicians and patients. We know there are many barriers to portal use. They lack internet access, etc. There have been studies on specific patient populations, the elderly, minorities, poorly educated, low socioeconomic standing, and other underserved populations. There have been studies in the Midwest, the Northeast, the West Coast, just a few southern states, Tennessee, Virginia, Texas, North Carolina. But what we don't know is the status of Mississippi. And that's important to know due to the high chronic disease rate in the state of Mississippi. There's been a study looking at physician perceptions, but not patient perceptions. And we also need to know what barriers patients face in order to promote portal use and education material use. So the purpose of this study is to investigate patient portal use among adult patients and see if they're accessing patient education material use and using it, and also to investigate barriers to portal use, especially health literacy. These are my research objectives. Do adult patients in Mississippi have access to patient portals? If so, are they using them? What barriers to portal use do they face? Is health literacy a significant barrier? Do adult patients in Mississippi have access to education materials within their portals? If so, are they utilizing them? And then is health literacy a significant barrier to education material use? And then finally, do adult patients in Mississippi perceive patient portals to be important for the management of their health? So this is the conceptual framework for the study. It's the Health Information Technology Acceptance Model. The technology acceptance model is actually widely used in health information technology research. It's very accurate for predicting behavioral intention and therefore behavior, but it doesn't have quite all the parts needed when looking at adoption of health information technology. So this study, this framework incorporates the health belief model, which is used to explain changes in health behavior. We're looking at behavioral beliefs or outcomes. If a patient believes there's a threat to their health, then they're more likely to participate in a change in their health behavior. And then the theory of planned behavior actually links attitude to behavior by looking at normative beliefs and the subjective norms, societal pressures. And then the technology acceptance model provides a direct relationship between acceptance of the technology and technology's perceived usability and ease of use. So here's where my research objectives fit into the conceptual framework. So research objectives 1 and 4, actually looking at are they using them? That's the behavior we're looking for. Are they using patient education materials? Are they using patient portals? Research objective 6, do they believe they're important? You have to have a positive attitude about something to have the intention to use and then therefore actually use it. And that also falls under our behavioral beliefs. Do they believe it's going to benefit them? Is the perceived threat of poor health enough to promote a positive attitude of our patient portals and education materials? And then our barriers to portal use and education materials use are Q2, 3, and 5. Those affect our perceived usefulness and our perceived ease of use, which ultimately affect their attitude. Do they perceive the portals to be important? So, research design and participants. This is a non-experimental study, which is appropriate when you wish to describe a population. And so we're looking at characteristics of users and non-users. It's a quantitative study. Dependent variable is portal use and education material use. Independent variables are health literacy and other barriers to use. Target population is adult residents of the state of Mississippi. Mississippi population is about 3 million. About 70% are 18 and older, so that makes a target population of approximately 2 million people. Ideal sample size with a 95% confidence interval would be 385. The plan is to mail questionnaires with Likert type questions, including demographics, internet use, medical records, etc., and health literacy to people registered to vote. So using voter registration rolls to obtain addresses, supply a postage paid envelope already addressed so they can be mailed back to me, and maybe even including an electronic link for those who wish to just submit it electronically. And the section on internet use and etc., that's going to be based on the National Cancer Institute's Health Information National Trend Survey, and that's actually survey instruments available to the public for free for those who wish to do surveys on health information use. So it'll be based off of that. I still am working on that. And then health literacy section is another free assessment tool provided by the Agency for Healthcare Research and Quality, and it includes 5 questions asking about health literacy, and you get a score that determines if it's limited, marginal, or adequate health literacy. I do not have my data analysis ready yet. I'm having to redo my section on internet use and etc. to look at those barriers, and once that's completed, I can work on my data analysis. So thank you for taking time to listen to my presentation, and I look forward to your comments so I can hopefully make this better.